If you're watching this, this is the Training Think Tank Joint Rotations playlist. Joint rotations are one of the movement tools that we use to teach and prescribe movement. And joint rotations are pretty much exactly what they sound like. And in actual movement, you'll see joint rotations happen all the time. So when you see somebody do a muscle up, you'll see their shoulder actually go through rotation. If you see somebody perform a snatch, you'll see their shoulder go through rotation. If you see somebody running, plant, pivot, and change direction, you'll see the pelvis rotate on top of the fixed femur to be able to reorient oneself and change direction. So pretty much any physical activity is going to have some form of joint rotation. So if you think about the movements that I just illustrated in a training environment, those things are usually done fast, explosively, at high forces, especially in common training cultures. And a lot of times people get injured doing those things, or as they age, they stop taking their bodies through rotations because a lot of the things that we do from a rotation perspective could be potentially a higher injury risk. So this is where joint rotations as a movement training tool come into play. I dig a lot deeper into this in the movement course, in our Training Think Tank movement course, but it's essentially deliberately taking your joint through a circular range of motion. It allows you to regress from that more intense rotation movement that would happen in a snatch or a muscle up and do something more basic and go back and just really work on your ability to control your end ranges of motion. It helps you maintain health in the joint capsules, and it's just a lower injury risk way to be able to maintain your movement quality as you age. So some people might ask, why would you perform these in training if you could just do the actual movement? So I wanted to illustrate this with a couple examples. Say you want to get your shoulders into a better position when you're doing a snatch. You go and get a bunch of one-on-one technical work with a USAW coach and you hear them say, pull the bar back. Or you do a bunch of banded stretching work to be able to open your shoulders up and get your shoulders farther behind you so that the barbell could be over your center of gravity. But you've been doing this for a while and you're still missing lifts forward. Joint rotations done from various positions can be an alternative to provide variance to your training to help you control and reinforce some of the ranges that you're opening up. Now, if you want to lift heavy weights and stabilize overhead, you're going to have to expose yourself to do that on a regular basis. But proper movement training and proper application of joint rotations will allow you to have a little bit more resilience to tolerate more and more frequent exposures and heavier exposures over time. And additionally, if you're just stretching the tissue over time, you could create some passive laxity in the joint, and joint rotations allow you to control, tighten up, and reinforce that range of motion. So if we use, that would be the first example to illustrate where this could come into play from a training context. The second would be, say you want to be a better open water swimmer and you do a lot of swimming in the pool, you have some sort of a structured program, and then you get into the open water, some chop comes, and you have to lift your head up, crane your neck forward, and you have to sight and spot your line so that you can swim forward. And every time you do that, just because you're muscle bound, you're thick in your chest, you've done a lot of bilateral training, it's really difficult for you to get into cervical extension and look and move. And so when you lift up, your feet come down and you start to sink, and then that creates panic, and then you have a negative context and association with open water swimming. Now, you can just take the approach of going and doing more and more open water swimming, or if you only have a dedicated amount of time in the week or maybe even in the year due to seasons to do that, you could have some sort of regressions in your training where you're working on the ability to get into cervical extension, lift up, rotate, and be able to actually spot where you need to go without having your body line change and sink in the water. So you get the point. There's a bunch of reasons that you could use joint rotations in training. And technical coaching and cueing, so going to a swim coach or going to an Olympic lifting coach, are great tools to be able to improve your ability, your economy, your overall lifts. But if your body doesn't have the requisite level of motion that's required to be able to actually implement the cues that you're getting, you're not going to make progress over time. So joint rotations is a way for you to have a self-driven way of improving your movement quality that you don't need constant oversight to do. What you'll see in this video playlist is me performing joint rotations. You'll see me performing them from various positions on various different joints. And it does look kind of funny. I know I open myself up to ridicule putting videos of myself performing those, but they're really effective training tools for getting control of your ranges of motion, and they're actually quite difficult. But when you're watching me perform them, I want you to focus on specific things and not focus on other things. What I don't want you to focus on is the range of motion that I'm taking my body through. If I were to take myself and compare myself to a 300-pound powerlifter, for example, the ranges of motion that I'm illustrating in these videos is really high. Conversely, if I were to evaluate my ranges of motion in comparison to a 150-pound male collegiate gymnast, I probably look like I am a refrigerator trying to move. So it's not necessarily about the range of motion that I'm going through. It's about you controlling and maximizing your end ranges. That's going to take into consideration what your injury history is, what your training goals are, your muscle mass, where you're tight. And so when you're watching, I want you instead to focus on my intention. The intention that I have to try to maintain stillness in my body in the areas that I'm not taking through a rotation. And then additionally, I want you to focus on how deliberate I am in the weakest point of the range of motion, not to find a compensation. So as an example, if I were to take my shoulder through this range of motion and start to move overhead, it's very easy as I start to get my end range to get this range of motion by compensating with my torso with some thoracic rotation. But I'm trying in the videos to be as deliberate as possible not to let any of that range of motion occur, because then it takes away from the focus of the actual intended training target of the movement. Your positions, again, they might look better if you have more freedom, and they might look way more restricted if you haven't practiced this and if you have, adhesions, past injuries, or anything that could potentially tighten you down. When you're watching these videos, they're not going to help you understand, I guess, internally what you're supposed to do. So I also wanted to give you some execution tips. And I have 3 of them. The first is to stay tight and don't soften as you're trying to expand ranges. It's very easy as you get to an end range to loosen your body and relax to try to open it up. But if you do that, you're not going to get the actual neuromuscular control that we're looking for with this specific training tool. The second is make sure that you only add load and only add speed after you've mastered the more basic, slower joint rotations. Going really fast through your end ranges of motion will increase your likelihood of injury, and that's really the complete opposite of what most people do movement training for. You don't want to do movement training and then injure yourself doing so, and a way to combat that is by being patient and deliberate before you start to add the more advanced, more fast, more explosive movement. And then the third is obvious and maybe more of a liability caveat as well, is make sure that you stop if you're feeling pain, if you have pinching sensations in the closing angle of a joint, or if you hear clicking. The first thing you can do on your own if you hear that or if you feel that is to just shorten the range. If you shorten the range and you don't experience pain, then you can operate freely in that range. But outside of that, you don't want to be pushing your ranges into a pain environment. The next thing you can do is think critically about that position if it's something that you need in your day-to-day movement or in your sport or relative to your training goals. Just because a body can move in a specific way doesn't mean that your body specifically has to move in that way. So it could be that you're trying to cultivate a range that's not really necessary for whatever you want to do training-wise. I'd also advise getting it checked out by a PT or a chiro. And just in general, as a movement coach or somebody that coaches people through movements, I'm not an advocate of stubbornly pushing yourself through pain to try to establish better movement quality. I haven't seen that have longevity. I haven't seen people get better with regards to how they move, taking that type of approach long term. And I've seen a lot of people that get injured trying to behave that way. So those 3 execution tips should more effectively help you perform joint rotations. Like is true for all the movement playlists on our YouTube channel, this is one of many that acts as a part of a bigger whole. So to improve your movement quality, you need to go through all of the movement tools playlists and think of them as acting synergistically with one another to, over time, be able to improve your movement quality. For anyone that's taken the movement course, Chapter 3 covers movement tools, and in the movement tools, we cover all of these more extensively. I cover where the inspiration for each category comes from, how to write training prescriptions with each tool, how to progress the training tools, what each specific movement tool is used for, and you've seen sample programs that utilize all of these over the course of 4, 6, 8, 12 weeks. And so you'll have a much better understanding of how to think about this in terms of long-term progress. As you go forward now, you have everything that you need to get better. You have every tool from a movement perspective that we could think of. You understand how to use them, you understand why to use them, and you have a bunch of videos in each playlist that illustrate the actual use of those movement tools. So good luck, and hopefully your movement quality gets better.